I was wondering if we have any indication of how long Ebola has been spreading for, or how long it had been spreading for before it was detected.
This is an important question. I think a lot of people have questions around that. So regarding the detection of this outbreak, again, I would like to remind everyone that the surveillance starts within the communities and starts with the health authorities in every single country. As soon as WHO was aware of the signal, support was provided to DRC to investigate as quickly as possible. And this ended up with the confirmation late last week. Investigations are ongoing to ascertain when and where exactly this outbreak started. Given the scale, we are thinking that it has started probably a couple of months ago, but investigations are ongoing, and our priority is really to cut the transmission chain by implementing contact tracing, isolating, and caring for all suspect and confirmed cases.
Officials now believe the virus may have been spreading silently for as long as 2 months before it was officially detected. That delay could have major consequences for both regional containment efforts and international monitoring systems. Health officials say the longer Ebola circulates undetected, the more opportunities the virus has to spread through families, healthcare facilities, border crossings, crowded transportation hubs, and funeral gatherings, all environments historically linked to rapid Ebola transmission. During those 2 months, infected individuals may have unknowingly traveled between villages, cities, or even neighboring countries before symptoms became severe enough to trigger alarm. Because early Ebola symptoms often resemble malaria, typhoid, or flu-like illnesses, initial cases can easily be misdiagnosed, allowing transmission chains to quietly expand. Experts warn that delayed detection creates what epidemiologists call hidden transmission networks, groups of infected contacts that remain unidentified for weeks. By the time the outbreak is officially confirmed, health authorities may already be chasing dozens or even hundreds of possible exposures. That dramatically complicates contact tracing, which is the backbone of Ebola containment. Every missed contact becomes a potential new transmission chain. Internationally, the concern is not that Ebola spreads as easily as COVID-19. Ebola is not considered an airborne virus in normal day-to-day settings. Transmission typically requires direct exposure to infected bodily fluids, such as blood, vomit, sweat, saliva, feces, urine, or breast milk. However, a prolonged undetected outbreak increases the probability of infected travelers crossing borders before screening measures are activated. Airports, bus routes, river crossings, and informal migration corridors can all contribute to wider regional spread before health alerts are issued. Global health agencies are now likely reviewing travel histories, unexplained deaths, and unusual fever clusters in surrounding regions to determine whether unnoticed spread has already occurred beyond the initial outbreak zone. The 2-month delay also raises concern about healthcare worker exposure. In previous Ebola outbreaks, doctors, nurses, and caregivers became infected before realizing they were treating Ebola patients, leading to hospital-based outbreaks that amplified transmission. Some analysts are also warning that funding cuts and weakened international surveillance systems could make outbreaks harder to identify quickly in the future. Reduced staffing, fewer field investigators, and slower laboratory testing can all increase the time between the first infection and official confirmation. Still, experts caution against assuming this will automatically become a global pandemic. Historically, Ebola outbreaks, even severe ones, have usually been contained through aggressive isolation, vaccination campaigns, safe burial practices, and intensive contact tracing? Ebola's mode of transmission makes it significantly harder to spread worldwide compared to highly airborne respiratory viruses. But officials say the danger grows substantially when outbreaks remain hidden for extended periods. The longer the virus spreads undetected, the greater the risk of larger clusters, cross-border transmission, overwhelmed healthcare systems, and international exportation of cases. For now, global health authorities say the priority is rapidly identifying every possible contact, isolating suspected infections, and breaking transmission chains before the outbreak expands further.